A terrible guide to the terrible terminology of US health insurance. The US health insurance system in 2025 is like a tricky game with words that are hard to understand. It's full of terms that make it tough to know what you're paying or what you get. Words like premiums, deductibles, and plan names like HMO or PPO can be so confusing. This guide will explain these words in very simple English, so you don't feel lost. We'll talk about costs, plans, and other important terms to help you figure out this messy system. Let's start with the main costs of health insurance. A premium is the money you pay every month to keep your insurance, like paying for a TV app you might not always use. For example, you might pay $300 a month, even if you don't go to the doctor. A deductible is the money you pay for medical stuff, like doctor visits or medicines, before your insurance helps out. If your deductible is $1,500, you pay that much first, then insurance starts paying. After that, you might have copays, which is a set amount like $20 for a doctor visit, or coinsurance, where you pay a part of the bill, like 20% of a hospital cost. The out-of-pocket maximum is the most you'll pay in a year for covered care, not counting premiums. If it's $6,000, after you spend that, insurance pays everything for covered stuff. These costs can add up, so always check your plan. Next, let's talk about what insurance covers and when you can sign up. Dental and vision insurance are extra plans for things like teeth cleanings or eye checkups, because regular insurance usually doesn't cover them. A drug formulary is a list of medicines your insurance will pay for, and drug tiers decide how much you pay, like $10 for cheap drugs or $50 for fancy ones. Open enrollment is a short time each year, usually in fall, when you can pick or change your insurance. If you miss it, you need a qualifying life event, like getting married or having a kid, to sign up during a special enrollment period. If you lose your job, Cobra lets you keep your work insurance, but it costs a lot. In-network doctors or hospitals are cheaper because they work with your insurance, while out-of-network ones cost more or might not be covered. Some plans have multi-tier networks, where costs change depending on which doctors you pick. Now, let's look at types of insurance plans and ways to save money. An HMO, Health Maintenance Organization, plan makes you use in-network doctors and get referrals to see specialists, but it's often cheaper. A PPO, Preferred Provider Organization, lets you see out-of-network doctors without referrals, but it costs more. An EPO, Exclusive Provider Organization, is like an HMO but doesn't need referrals. A POS, Point of Service, plan mixes HMO and PPO rules. For saving, AHSA, Health Savings Account, lets you save money before taxes for medical costs, but only with high deductible plans. An FSA, Flexible Spending Account, is similar but works with any plan, and you must use the money by the end of the year. An MSA, Medical Savings Account, is rare and like an HSA. An HRA, Health Reimbursement Arrangement, is money your boss gives you for medical costs. Medicare is for people over 65 or with disabilities, and Medicaid helps people with low income, but both have complicated rules. This health insurance system in 2025 feels like it's made to confuse you, which is called obfuscation. All these terms make it hard to know what's going on. So, what can you do? Read your plan carefully, check the premiums, deductibles, copays, and out-of-pocket maximum. Look at the drug formulary and find in-network doctors. During open enrollment, compare plans like HMOs or PPOs to see what's best for you. If you can get Medicare or Medicaid, learn how they work. Talk to your boss or an insurance helper for advice. The system is tough, but knowing these words can help you make better choices and avoid big surprises.